What can a little boy with polio, a hospital destroyed by a hurricane, and a senior citizen exercising possibly have in common? The truth is more than you can imagine. The common link to all these stories is the oldest continuously working public health organization in the world, the Pan American Health Organization. The unfortunate case of a Peruvian boy called Luis Fermin Tenorio Cortés in 1991 was the last case of polio in the Western Hemisphere, thanks to a massive vaccination effort led by PAHO. The Americas were certified as polio-free in 1994, 2 decades after becoming the first region in the world to eliminate smallpox. Immunization efforts continue to bring the benefits of vaccines to even the most remote parts of the hemisphere through Vaccination Week in the Americas, an initiative so successful that it's being emulated in other parts of the world, including Europe.
We cry for peace, but we live for war.
To love someone is to care for them. To love someone is to help them grow healthy and strong.
Sometimes she love me, sometimes
make sure that your kids are up to date on their vaccines. Take them to your closest health center to get them vaccinated today. Vaccination, an act of love.
Disaster preparedness, management, and response are a priority to PAHO, since vulnerability to disasters can greatly affect public health. The area of emergency preparedness and disaster relief works with member countries not only to meet the health needs of disaster victims and rationalize the distribution of disaster relief, but also to change behavior and practices that cause vulnerability. Campaigns on active aging are also an important part of PAHO's work, now that many in the Western Hemisphere are living longer. The organization disseminates messages such as this public service announcement.
Active aging is more than avoiding disease. It is a whole new way of enjoying life at all ages. Exercise your mind. Exercise your body. Active aging makes a difference.
For over a century, PAHO has been working in collaboration with ministries of health, other government and international agencies, non-governmental organizations, universities, social security agencies, community groups, and many others to combat disease, lengthen life, and promote physical and mental health throughout the Americas and the Caribbean. Created in 1902, the Pan American Health Organization is permanently reinventing itself to better address the needs of its member countries. In this new millennium, the organization more than ever is promoting primary healthcare strategies which reach people in their own communities, assisting countries in the fight against re-emerging diseases such as cholera, malaria, dengue, and tuberculosis, as well as problems such as the HIV/AIDS epidemic. It provides technical cooperation and social communication support to programs aimed at preventing transmission of communicable diseases. Chronic diseases such as diabetes and cancer, as well as the problem of obesity, which are increasingly affecting the populations of developing countries in the Americas, are also the targets of PAHO's efforts. In keeping with the spirit of the Millennium Development Goals adopted by the United Nations in September 2000, the work of the Pan American Health Organization focuses on the most vulnerable groups, including mothers and children, workers, the poor, the elderly, and refugees and displaced persons. It focuses on issues related to equity for those who lack access to health, and on a Pan-American approach, encouraging countries to work together on common issues.
Usted ya dio el paso, lo hizo voluntariamente, sin ningún interés ni esperando nada a cambio. Donó su sangre segura a un desconocido. Pero ya le contó a sus amigos cómo se siente después de haber ayudado a otra persona. La amistad es más que ir a pescar o una plática casual con sus amigas. Es también compartir la importancia de estos momentos. Lo más seguro, la próxima vez que usted done su sangre, no tendrá que ir solo.
The health of children in the Western Hemisphere has benefited immensely from the work of the Pan American Health Organization, not only from the vaccination efforts, but also from the mobilization of new political, institutional, and financial resources to foster the adoption of more comprehensive evaluation of children by health providers, and efforts directed at diminishing maternal mortality. PAHO is also moving aggressively in the fight to reduce the use of tobacco, emphasizing the health aspects and the high cost to the countries of tobacco use.
Stop smoking around me! Without cigarettes, the world will be much better. Smoking is bad for your health, and when grown-ups smoke around us, we are breathing in their smoke too.
Cigarette smoking is bad for your health and the health of those around you. Don't smoke around children.
To increase the access of poorer populations to health care, PAHO has designated 5 countries as priority countries, focusing on correcting inequality in access to health services. Advocacy in this area is also directed to reducing gender inequity, which reflects in some health problems of women, especially domestic violence.
¿Escuchas eso? No, no escuchas. Ven, acércate. Ahora escuchas. Yo sí lo escucho. Y sé que tú también. La violencia contra la mujer es un castigo doble. Terminemos con esta injusticia.
Despite the progress that its work has helped to achieve, the Pan American Health Organization still faces today challenges that are as daunting as the threats of over a century ago. These challenges serve to energize the organization. They are the fuel that will ensure that PAHO remains as vital to the Western Hemisphere 1 century from now as it was when it was created.